Good evening. Welcome to another episode of Hudson Health. My name is Dr. Amir Syed. I'm accompanied by my sister, who's a co-host, Dr. Sakiba Syed. We're both internists in Jersey City. Today we have several topics that we want to talk about. The first topic is we want to speak about, obviously, the coronavirus. Hopefully everybody had a very safe and small Thanksgiving. It's unfortunate that the times that we're living through, but we do see glimmer at the end of the tunnel now. So having said that, I'm going to hand that over to my sister, who can speak to you about the current vaccines that are out there now.
So right now we have two vaccines that are contenders and a third one on its way as well. Pfizer and BioNTech, along with Moderna, have said that they have almost a 95% efficacy rate, which is amazing, compared to the flu vaccine, which provides a protective percentage of about 40 to 60%. This is really great news. If the public continues and gets the vaccine as it's being rolled out, we are making an assumption that we will attain herd immunity by the end of next year. What this entails is now stratifying who gets the vaccine. And I think the CDC, along with the FDA, are working very closely together to announce the rationale that they're having, or the rationale that they're going to have to stratify the distribution of this vaccine. I think they said about 40 million units would be distributed, doses would be distributed by the end of this year. And I think Vice President Pence made that announcement that by the end of this week, he will have a rollout plan for this vaccine. That's promising news. That's really great news for all of us because there are so many unknowns. This does not really tell us exactly where we're headed, but at least we know there might be some end in sight at this point.
I know there are a lot of people that are putting out misinformation regarding the vaccine, regarding them being misguided, whether they're public health officials or whatnot, but you do have to remember that do follow the data and follow the science. This is a clinical breakthrough in medicine that never has there been a vaccine that's been produced in such a short period of time in response to such a big problem that we're facing. Now, they're saying that it's 95% effective. Now, 100% of those people who did receive the vaccine, none of them had severe disease that required hospitalization. This is very, very important to know. So the first phase of the rollout is probably going to be for healthcare workers. And then they're going to risk stratify people who are in nursing homes, people that are above the age of 65, people with those with underlying medical conditions. And then hopefully by April, we can get it out to the general public. But please don't misinterpret any information that you read. You should follow what the CDC says. It's a very safe vaccine. I'm probably going to be one of the first people to get it, just because I see the science of the data behind it and how good it is, okay? We also have a lot of good therapeutics out now. So all the people that are being admitted to the hospital, they're surviving. The survival rate is getting better. And we're getting better at this. Remember, this is something in January we knew nothing about. And come December, we already have vaccines that are going to be in the arms of Americans by the middle of December.
I think this is really important, and we need to emphasize this enough. Please ask your physicians, ask your doctors, ask. We might not have the answers, but we're really working on it. And I think now finally things are coming to a close. Like my brother just said, first time in history has a vaccine been rolled out in such a short time of period. This is extremely, a powerful message from the leadership to us that, you know what, they do care for us. This is coming out and, we're all working in it together. There are going to be a lot of questions. There are some side effects that are being reported, but very minimal, just like the flu vaccine. It is going to prime your own immune system to fight this disease off. There have been side effects of headaches, malaise, not feeling well. There have been been some serious side effects, but very rarely, but none in the ones that were reported in the Pfizer or in the Moderna trials. I think this is extremely important that we're all on board, and you have to understand that this is an extremely, extremely important step in scientific breakthrough. And I think that all of us working together will make it happen. We just all have to be on board. I think the armamentarium with the treatment modalities, I think the better hospital awareness and care that's being provided to the patient, and the fact that our medical personnel are very well trained for this situation. I think we're really, really in a good place at this point.
Correct. Having said that, we're going to go for a short break, and then we'll come back and we'll introduce our guest, Dr. Amit Patel, who's a hematologist oncologist, who's going to come and speak to you about pancreatic cancer.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Okay, we're here with Dr. Amit Patel to discuss further treatment options for different types of pancreatic cancer and what you basically should be looking out for.
Now, pancreatic cancer is the 4th leading cause of death in the United States, and 57,000 people are diagnosed with pancreatic cancer every year. They're great options, they're great treatment modalities, and I would love Dr. Patel to go ahead and discuss what we have on the table so our patients are well aware of what's out there.
Thank you for having me, and thank you for that kind introduction. You know, the best way to approach pancreatic cancer treatment is always and historically has been to break up the treatment in patients that are diagnosed at an early stage and are surgical candidates versus patients, unfortunately, that either are diagnosed in the advanced or late stage or for some reason are not surgical candidates. And that's really where our treatments kind of separate and guide us as to the best possible options. In terms of patients that are diagnosed, unfortunately, the majority of patients are diagnosed at a later or advanced stage or are not candidates for surgery because of the type of surgery involved. So more of our research previously has been focused on options in terms of treatments for these patients to increase their survival living with pancreatic cancer, as well as the possibility of trying to get patients that are not surgical candidates up front to a point of surgery. Recently, however, though, a lot of our focus has now turned to patients that are able to have surgery and focusing on getting them to the point of having a complete resection and having no evidence of cancer left behind. So it's a very exciting time in terms of pancreatic cancer. Unfortunately, the statistics still remain pretty dismal in terms of the survivors, either with local early disease or metastatic disease. And now what we're doing is actually profiling these cancers, including genetic testing of patients and genetic testing of the cancer cells themselves. And we're able to identify targeted therapies that we can use for these patients. So we're not using just our known and approved chemotherapy treatments. We're using them either in combination with these newer targeted agents, as well as newer options, including immunotherapy, depending on what type of patient we're treating.
Now, the patients that I usually see in the office, they'll come in and when we've diagnosed cancers, usually you're absolutely right. They're usually late stage cancers that are usually diagnosed because patients are far along in their disease process. They come in with weight loss and lack of appetite and very non-specific complaints. However, I think just utilizing a better screening method in addressing those patients that have one maybe possibly family history of cancer and just maybe really putting out an outreach program. I think the pandemic really did a job in taking us backwards in identifying those patients. And I think we should all work together to maybe have a better platform for early identification of this deadly disease.
I agree. Unfortunately, we've seen patients that, if specifically related to the pandemic, not so much that they were ignoring symptoms, but they were too afraid to come into our offices, especially coming into our hospitals and being potentially exposed to a COVID positive population to address any of the symptoms they had. And you're exactly correct. A lot of these patients present with such common but vague symptoms that they're not thinking pancreatic cancer right away. They're thinking indigestion, or they're thinking they ate something that didn't agree with them. They'll try over-the-counter medications, but it's really addressing those symptoms without any effective treatment and how quickly they progress as to where we can identify and capture patients so that they can be diagnosed at an earlier stage. In terms of screening, we've had multiple clinical trials evaluating possible screening modalities, but I think the best tool remains seeing your doctor and getting a thorough physical exam, getting your blood work checked, because we haven't gotten to the point like we have with other cancers of having a mammogram or a colonoscopy to have a test that we can use for pancreatic cancer. So always very important also to identify those patients with that family history and test appropriately and go from there in terms of identifying their risk of developing cancer, pancreatic cancer as well.
Thank you so much, Amit.
Wow,
We
very
really
powerful
appreciate
information.
We really
Thank
appreciate
you. Really
this.
appreciate this.
You're welcome.
We look forward to having you on again.
Absolutely. I look forward to
Thank
it.
you so much.
Thank you.
You're welcome.
All right. Pleasure.
Thank you.
You know those times when you need to see the doctor, but you just can't get to the doctor? So where do you go? Go to the App Store, download the Telemed app from RWJ Barnabas Health, and you see the doctor right away. From any mobile device, whenever you want, wherever you are.
Quality care, no appointment necessary. The doctor is online when you download the Telemed app.
Don't you feel better already?
RWJ Barnabas Health. Let's be healthy together.
Good Friend Self-Storage in North Bergen, New Jersey is a fully climate-controlled facility equipped with state-of-the-art security, packing supplies, a Refer Friend program, and multiple loading docks convenient for commercial use. Located just off of Route 3 at 4301 Tunnelly Avenue, Route 1 and 9. Call 201-867-2444 or visit us on the web today. Good Friend Self-Storage. Let us be your good friend.
Rama Jewelers, located in the Lyndhurst Shopping Center at 413 Valley Brook Avenue, Lyndhurst. Come for all your jeweler needs at Rama Jewelers, where you will find a fine selection of necklaces, earrings, rings, and bracelets. Choose from one of our complete sets, our many signature items, or find the perfect engagement ring. Come on down. That's Rama Jewelers at 413 Valley Brook Ave, Lyndhurst. Call 201-939-5784 or visit us online today.
Welcome back to Hudson Health. We had a great discussion with Dr. Patel regarding pancreatic cancer. You know, there's certain risk factors that you should be aware of. Family history is one of them. Having a very high fat diet, alcoholism, smoking. Smoking is still one of the leading causes of pancreatic cancer. Remember, pancreatic cancer has always been described as a silent killer. We don't know when it happens and who it happens to. Now, with better genetic testing, more modalities, screening methods, we may be able to identify it first. But there are certain key symptoms that you should realize. Unexplained weight loss, lack of appetite, family history, and if you are a smoker. You know, it takes 10 minutes to get a CAT scan done, but it can give you all the answers you might need to possibly catch something very early on and treat it very early on.
And that's absolutely correct. And I think that's key. We sometimes say, oh, I'm having indigestion, I have some agita, you know, and these questions need to be brought to your physician's attention so that, you know what, we can look into what the problem is. It's easy to be dismissive of some symptoms because they're so non-specific. But again, if they're recurring and they are interfering with your activities of daily living, do talk to your physician. Early feeling tired or more than usual, not having an appetite, losing weight, being jaundiced. I mean, these signs are very important. We've just lost a true TV icon, Alex Trebek, and he was diagnosed with pancreatic cancer, stage 4, 2 years ago, and he passed away on November 8th. And it just brings to light that, you know what, cancers don't see any boundaries, you know, any age, any sex, any ethnicity. It's very important to be very, very aware of the ability of anybody to get it, and it's extremely important to talk to your doctor about it. I think one of his most important messages that he had in his posthumous, TV airing was, keep the faith, be strong, we'll get through this. And I think we all need to understand with the holidays around the season, we need to be continuously aware of our health and be open about our discussions.
And remember, small little things that you know about either chronic pancreatic insufficiency or pancreatic cancer is that yes, weight loss is one of the main things. But eating fatty meals and not being able to digest your food like you used to do it before, that also might be a key factor in developing this whole thing and probably catching it earlier. There's a lot of new medications out which do help with these things, but remember, we don't want to wait to the very end before we do this.
I think screenings are extremely important, and that goes for all screenings. We think that, don't forget your mammograms, get your colonoscopies. Instead of a colonoscopy, if you're not comfortable, there's other modalities of screening like the Cologuard or the fecal occult blood. Talk to your doctor about this. Go to your OBGYN, get your cervical cancer screenings, and all your physicians' offices have the information that we can provide to you, and please open up and ask questions. We're trying very hard to recover from the time lost during the pandemic by asking these questions to our patients, and a lot of patients are very open to it, and a lot of patients are not because they're still scared of the COVID. Yes, the COVID is there, but it's not in your physician's office, it's not in the hospitals, and it's not in the testing centers as well. So that's one thing that you should understand, that we're all in this together. Screening is extremely important. Go to your annual wellness exams, get your wellness Medicare exams, your preventive exams, your insurance allows for it. And even if you don't have insurance, ask your doctor for your clinics and your doctor's office. They do offer certain programs that will allow for these screenings to occur.
So with the numbers, the case numbers going back up, New Jersey reported today 5,000 cases. What the next 2-3 months are going to be very dark days for us. However, please do not allow that to delay your treatment. What was going on before is not going on now. The disinfection methods are a lot better, and it's become safer. for you to continue treatment and or seek screening exams?
I think Robert Wood Johnson has on their website, you have all of the phone numbers that are available to you to call for colonoscopies, for mammograms, for cervical cancer screenings, and utilize the numbers. I mean, the community is offering these. It's to your best interest if you utilize them. I mean, I will let you know myself, I've diagnosed within 3 months of opening and seeing some patients for their annual wellness exams, we've diagnosed almost at least 10 to 15 cancers. And so these were just sitting around and not being treated because people were scared, legitimately so. But again, keep your lines of communication open with your physicians and talk to everybody.
Absolutely. Now, at least we have, with the advent of telehealth, there should be no reason why you should not be able to reach out to your physician. Having said that, we're going to take a short break and we'll be back with some more information for you. Thank you.
Thank you.
Pen and Pencil Properties, Jersey City. Shaping the workplace with state-of-the-art office spaces that address your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at penandpencilproperties.com. Pen and Pencil Properties, building Jersey City for everyone.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Stevens Jersey City Ford, located right off of NJ 440 North. Across the Hudson Mall is your one-stop for all your automotive needs. Check out Ford's latest models like the 2020 Ford Fusion with its stylish looks and hybrid options, or the unparalleled high-performance 2020 Ford Mustang. The 2020 Ford F-150 Raptor is ready for those rugged off-road terrains with trail control. Need a mid-sized truck for your towing and hauling? The 2020 Ford Ranger will deliver. The 2020 Ford Escape is a luxury SUV that was made for comfort and adventure on the go. Returning is Ford's legendary Bronco, which takes you back to the true meaning of off-roading. They are now available for pre-order in our showroom or on our website. Let us help you find your next vehicle. Stevens Jersey City Ford, 201-432-7272.
Welcome back to Hudson Health after a short break. There's a couple of things that we want to touch on before ending the show. And one of the most important things is, what is the effect of COVID during our holidays? Mm-hmm. Now, we did have, unfortunately, a somber Thanksgiving. And now Christmas is approaching, and the weather's getting colder. People are going to congregate a lot more. Please keep it to a minimum. You know, you want this Christmas to be special, but you don't want it to be the last. I was having a discussion with my sister earlier on the fact that there's so many people that are still going to the mall and doing shopping, and it's bustling at the seams. And if you can do your shopping, try to do it online. Keep it safe, keep it short, and just stay within your bubble. Stay within your immediate family bubble so that you don't go ahead and spread it. And Dr. Sayed's going to touch on certain statistics that were just recently published regarding who are the carriers and who are not.
So we were just reading up on the report by McKinsey, and they I thought that was surprising to me that the children, the younger age children are not as, they don't get the disease as aggressively. It's the teenagers, the 16 to 21-year-old children, young adults. They seem to carry a higher viral load and therefore are risking transmitting the disease more so than other people. And I think that higher viral inoculation, or the higher viral count that is spreading from person to person, is the Christmas gift that nobody wants around the holidays. So it's really important to understand that COVID, again, can infect anybody. It does not see your age, it does not see your sex, it does not see your ethnicity, your creed. It's a very dangerous situation to be in, and young children, along with their families, they need to understand that this is something that's only going to go away if we all work together at this. And this is going to come from a communal approach in tackling this pandemic. And there is light at the end of the tunnel. We have better treatment modalities, and hopefully with better implementation of public health measures such as wearing your mask and washing your hands and social distancing, along with the vaccine rollout, I think we're headed in the right direction. But again, we all need to work at it together. It's extremely important that we're all in this together because it can affect anybody. We've had physicians, colleagues pass away while trying to save people's lives. So this is a real problem that we're dealing with day in and day out. Our message to you is please be safe, be healthy, enjoy the holidays, but be smart about this.
Remember, we can't stress enough the importance of still wearing a mask, still washing hands, and trying to minimize as much contact as possible. We can only enjoy a good summer if we tough out these 2-3 months. We can have a fantastic summer, and we are looking forward to having it. And this misinformation about the vaccine, that it's a live virus, it's this, that is not true. This is one part of the virus that they were genetically be able to sequence that they inject into you so that your body builds its own immune response. Your body's immune response is what kills the virus. Mm-hmm. It's not the other way around. So please be very, very careful about this misinformation. And those that are high-risk populations, like we touched on earlier, they should get the vaccine first. And then from there, we can de-escalate. And hopefully by the end of the spring, we'll have a fantastic summer to look forward to. So this year, Memorial Day weekend is probably going to be a fantastic one. And that's what we all want. Our hospitals are already overwhelmed. And now, due to the advent of the flu season, now it's going to be a double whammy. So we don't want you going to the hospital for the flu, whereas the hospital is full of patients who already have COVID. So, one small little mistake can affect hundreds of thousands of lives. So please, mask up, and please wash your hands, and socially distant. I cannot reiterate that more.
I was just telling you a story about a patient who told me that they all congregated for Thanksgiving and they thought that they were being smart about this. What they did was everybody got a COVID test before attending this Thanksgiving feast. And what happened was they got the rapid test, wound up at the feast, and diagnosed 2 people with COVID today that were attending that feast. So again, you have to understand that these rapid testings are not necessarily an okay to get together and spread the disease. It's important that you understand that right now everybody's at risk. Be smart about getting together. You risk your own grandparents, you risk elders, you risk friends, colleagues. Be smart about getting together.
We want to thank Dr. Patel
Yes.
for being our guest speaker. We look forward to bringing other speakers in their specialties to talk about different things and different day-to-day health conditions that you should be wary of. And with that, have a good evening. Thank you, Dr. Syed, for being here.
It's a pleasure.
And we look forward to our next episode of Hudson Health. Thank you.
Thank you.